Hello, everybody. Andrea Twarowski here with Dentalelle Tutoring, and this is part of the patient edition files. So I want to talk to you guys about fluoride today, and actually let me just move my webcam, and I apologize for the mess. We are moving in less than a week, so things are crazy. So I do apologize because I don't like things messy. So just ignore that. But I want to talk to you guys about fluoride today. So I work as a dental hygienist about 2 days a week. I used to work full-time, but now I am a full-time tutor. And I find a lot of patients do ask about fluoride, and it's probably because they have been misinformed. And I'm not telling you that I love it, and I'm not here to tell you that I hate it. I'm just here to give you guys the facts, and then you can make your own decision. So, and this is kind of my opinion too. So it's not just about the facts, but it's kind of about my opinion a little bit too. So the facts are that a lot of people are afraid about fluoride because they hear all of the horrible things about it. And what I first would like to say is that if you have too much of anything, it's bad for you. You know, if you have too much water, it's bad for you and it can kill you. And I've had a lot of patients come to me saying that eventually fluoride can kill you. So if you're swallowing, let's just say, toothpaste in it that has a lot of fluoride, and if you're swallowing the whole tube of toothpaste, then yes, that can harm you. But the fluoride that you have at the dental office, I actually prefer because we can help to control it. So depending on the dental office where you go to, you might have the fluoride mouthwash or a fluoride varnish where they actually paint it on. And in some of the older offices that are still using the old technique is they put foam from fluoride in trays and then they leave it in that way. But I haven't done that for probably about 10 years, but that's still manageable. But the thing about fluoride is it does help to protect your tooth enamel. And these days, with all of the acidities, all of the sugars that we eat and drink, it's absolutely necessary. Because unfortunately, if you're not getting that, your enamel becomes thinner and then it becomes stained and then it actually starts to chip away. But to be honest, if you have too much fluoride, the same thing can happen. The enamel can actually turn brown and start to chip away if you've had too much. But you can only have too much as a child. As an adult, your enamel can only absorb so much because your enamel has stopped developing, if that makes sense. But as a child, depending on the age, your teeth are still coming through. And your enamel is still developing. So yes, if you have too much fluoride, it's not a good thing. But too much is a lot. For example, if you go to the dentist every month and we give you a fluoride treatment every month, that would be too much. If you are drinking fluoridated water and eating toothpaste and having fluoride treatments every couple months, yes, that's too much. But that's the only case where it would be too much. I've seen children come in with signs of having too much fluoride, but that could just be because they had swallowed toothpaste every day as a kid. That's why as a child it is important to give them toothpaste without fluoride until they understand to spit it out. So if your child's 10 and can finally spit out the fluoride, that's a little old, but I'm just saying, then you need to give them toothpaste with that in it. Because if their toothpaste doesn't have any in there, their enamel is not becoming stronger, it's becoming weaker because of all of the acidity that comes in. So even if we give them a treatment every 6 months, they need that extra fluoride in their toothpaste to make the enamel stronger. And as an adult, it works a little bit differently because our enamel has stopped developing. What it does is, as an adult, as we eat all of those acidic things and eating a lot of sugar, that actually changes the pH in our mouths, and that starts to eat away our enamel. But the good news is, using a toothpaste with fluoride at least twice a day helps to, the term is remineralize that enamel. So it's not bringing the enamel back, but it's helping to protect it so that anything we eat or drink that's acidic or, you know, with a lot of sugar, it sort of eats through that layer first, but it doesn't touch our natural enamel. So does that make sense? If not, please let me know, because I'm trying to explain it in a simple way, but to give you guys as much info as possible. So you might be asking, do I use a toothpaste with fluoride? Yes, I do, every day, 3 times a day, because I like to brush after lunch too. But yes, I do. And yes, I still get a fluoride treatment every 6 months. But I also have thinner enamel. I have always been told that I have thinner enamel, and some people do and some people don't. So when I was a child, my tooth enamel just developed more slowly and thinner. It's just how it is. So for me to get a cavity, it can happen quite easily. So I have to be even more careful to protect my enamel. So if you're the type of person, or your child is, who goes to the dentist and gets a cavity every single time, it's probably due to lack of fluoride, but it could also be due to what they're eating or drinking. You need to be careful with sugars and with acidity. If you're sucking on a lemon every day, that's pretty acidic, right? So even if you're getting that fluoride, it doesn't have a chance to kind of catch up. So again, I'm not saying I love it. I'm not saying I hate it. I'm just trying to give you guys as much facts as possible. But yes, if you have too much fluoride, it's not good, but that's hard to do these days. So if you guys have questions about that though, please let me know, because I have had a lot of patients asking questions, or a lot of parents saying to us that they don't want their child to have any fluoride, yet every time we see them, they have 3, 4, 5, 6 cavities. And it's because we're not allowed to give them fluoride, because it does depend on the parents. I'm not saying it's the parents' fault, but I'm saying that the parents haven't been educated, or they're not listening, of the importance of fluoride. So please share this. I feel bad saying that because my place is a mess. Normally I'm more professional. But if you guys have questions, just comment and let me know, and I am so happy to help. So I will see you guys in the next video, and thank you so much for watching.